So are you, Patty.
Okay. So this is a little PowerPoint presentation on virtual faculty-student mentorship, supporting advanced practice nursing students in their academic success while working at the bedside. I am Patricia Moran. I'm here with my colleague, Anne-Marie Rossiano, and we're both from Stony Brook. And Justin, who was at Stony Brook with us when we did this, who, as I said a few seconds ago, is now at SUNY Upstate. So, okay. So the objective of this is, at the end of the session, the participants will be able to identify techniques on how to increase student engagement, focusing on oneself, describe the purpose of reflection, and how to implement this in group discussion while focusing on the program's curriculum. So distant online education, that's pretty much here at Stony Brook, which we do in the School of Nursing here. Distant online learning has become an option for students who want to continue their education, but are unable to participate in the traditional college experience due to either family, work, or geographical restraints. The advantages of doing online education include opportunities for more students to continue their education at their own pace and on their own schedule. It is more cost-effective and convenient for these students. And class sessions can occur in real time, meaning synchronous, or be recorded and viewed at a time convenient for the student. So in 2015, I was doing my postdoctoral work here at Stony Brook. I've been teaching at that point in the School of Nursing for about 3 years. And I ended up doing this Course Connect pilot. And the plan was, the purpose was to connecting distance learning students to on-site faculty to promote student integration and evaluate their satisfaction. It's just something that I was observing while I was here. The majority of our students were online students. Say we had 80 students enrolled that semester, 15 were actually coming to site, but the other, 70 whatever were out in the cloud out there, all on the internet. And there was a big discrepancy. There was a disconnect, I guess I should say. So the pilot aim of Course Connect was really to provide a learning experience that teaches safe quality healthcare to both the on-site and the online student, these master prepared nurse practitioner students. We wanted to enhance the learning of all students while improving their outcomes, their midterm, final exam and quiz grades. And obviously our end result is that they would pass their certification in their specialty. And just so you know, our students in this program were master's prepared. They already had their bachelor's, they were registered nurses, and they were already working in hospitals at the bedside. So the characteristics of an online student, and according to the literature, the successful students are the ones that are self-disciplined. Their learning style is usually that they're very independent, self-motivated, and they can collaborate, and they're just good participants. They're obviously the type of student you want to work, if you're a student you want to be within a group project. They're very computer savvy. They have effective time management skills. And just as an example, learners usually need about 12 hours per week to really successfully complete a 3-credit course. Our course here that this study was done was a 4-credit course. So our students technically needed about 16 hours a week to complete the course, to do all the assignments and keep up with the readings. Again, these successful students, they're also very proactive in student engagement. And now our students here at Stony Brook during this was just really our perceptions, the faculty. Our students had been out of college for a while. Some of them had coming back after 20 years. They were not tech savvy. They were very dependent. We had a lot of emails, a lot of tears. They were overwhelmed. And also I had those competitive students who do better actually in a face-to-face environment where they were used to in their undergrad programs getting A's, and they might have gotten B's or B pluses as a distance student. And they were very upset with their grade, even though B's fine. But if you know nursing students, they are very competitive. And also, again, they just were poor computer skills. They were not tech savvy. This was just our, what we were dealing with here at Stony Brook. And again, as I said, most of our students were distance students. So dealing with technology. I myself am not tech savvy, but I've learned a few things here and there. So dealing with technology, we had here at Stony Brook, the learning management system. The one here within the School of Nursing was tailored to the School of Nursing. I know there are LMS systems out there. So during 2015, when this was being done, we just had the LMS, as I said, tailored to the School of Nursing at Stony Brook. At this point, we are actually using Blackboard, again, just tailored to our program. But generally, though, this includes software for creating and editing course content. There's communication tools that we've uploaded, assessment tools, and other features for managing the course. And we actually, we put a lot into these things, but the students don't even realize what we do for them or the resources we give them. They're just, obviously my more successful student will, but there are these other students that don't even know that there are different folders or things that they can open up and think that there's resources there to help them. So just looking at Stony Brook's University's adult gerontology nurse practitioner program, just our background. So at that point, we were a hybrid program. We offered distant education, and there was some on-site requirements, though, even though it was distance, the students were required to come on site. And we also did have a few students that actually would come to class on Mondays, and they were our on-site students, but there was very few, I'd say 15 students, the most that came on site. The majority of them were distant. The adult gerontological primary care nurse practitioner, our program, we prepare registered nurses to become expert primary care providers. The purpose of the study was to evaluate the utilization of a web conferencing software. So I ended up using Adobe Connect. At that point, I didn't even know what Zoom was, but we used it with advanced practice nursing students. And I wanted to assess their satisfaction with using Adobe Connect to provide supplemental educational opportunities to these distant students. And then I wanted to compare the perceptions of inclusion of these participants to the distant students that did not participate.
And if I may interject for a moment, Dr. Moran,
Mm-hmm.
I was, prior to me leaving Stony Brook, I was the director of the adult gerontological nurse practitioner program based in primary care. And our students really thrived upon, they wanted the freedom of allowing to work on their own schedule, but they also wanted the faculty to be there, and they would email you at 2 o'clock in the morning, correct me if I'm wrong, Dr. Murray, and they expected, they would email you at 2, then at 3:30, and then they were at 4, because some of our students worked overnight shifts. So when we would get back to them about 9, 10 o'clock in the morning, our normal time, they would be fast asleep. So it's trying to, Dr. Moran noticed this, at this point, that she really wanted to bridge the two together and try and figure out how we could really meet our students' needs and to become more successful.
Thank you. You're correct. Mm-hmm. So our project design was to enroll distant students from the Advanced Theory and Clinical Practice course on a voluntary basis to participate in live discussions with the lead faculty, who was myself, in a seminar format during the first semester of 2015. I had the students register for one 90-minute session each month for the fall semester. So what I would do at the beginning, for September and August, I would send out a blast email for a doodle poll. And once I knew who the students were that were participating, those students would get my email, and they would pick what days they would want. And there were some evenings, there was some days, and there was some Saturdays in there, just depending on their work schedule. And once we were on, it would be for 90 minutes. And the topics for the supplemental instruction was really driven by the need of the student attending the seminar. So I would sign on whatever day I had a session with them. There could be 4 or 5 students. Overall, 19 did enroll to participate. And I would just leave it up to them. We would work on homework assignments on how to do what's called SOAP notes for them, which is extremely difficult for them, for some of them to understand. We'd go over issues that they were having in their clinical sites. We would discuss issues regarding finding clinical sites, just whatever they needed. I think they just needed to have some connection to the faculty regarding assignments, just clarification on certain things. So it was all driven by them. I would sign on, and I never knew what I was going to be discussing with them. So the project evaluation, there was a pre and post survey evaluated, given to the students to evaluate their satisfaction with the online seminar. This was provided to all my student participants, again, which was about 19. And then I did a comparison survey, was also given to the non-participants of the survey that didn't participate. to see their overall satisfaction with the online education for the semester. The only ones who did not get or not participate to the survey were the students that actually came on site every Monday. Because they were actually on site, so they were excluded from the evaluation. So these are my results. If you can really look at the one to the left with the green and the red, that is the students who participated. So the green was their answers prior, the pre-course evaluation, how they felt. So you can see like the second one, as a distant online student, I felt isolated from the school. So at that point, almost 60% of those students did feel isolated from the school, where after they completed all four sessions with me, you know, we had one a semester, September, October, November, December, it went down to 15.8% for those students feeling isolated. I'm trying to just think of some of the ones they felt comfortable interacting with course instructor as a distant online student. Prior to participating, it was about 80%. After participating, went up to 94.7%. Also feeling comfortable participating in course discussions as a distant and online student, again, went from 80 to 100%. And just that their online learning was meeting their expectations, it pretty much went from 70% up to 100%. Now the slide to the right is also a comparison to the students that participated and the students who did not participate. So again, the second one always amazed me. Second question, as a distant online student, I feel isolated from the school. Well, the ones who did participate with the Course Connect, only 15.8% felt isolated, where the other group that did not felt 40%. So you can compare these, and I actually have on the next slide, we really just broke down the big ones. So what we learned as faculty was just using a web conferencing software and a distant learning showed high post-course satisfaction for those who participated in the study. So again, there was the three things. We had 100% post-satisfaction scores were related to using the internet to complete their coursework, feeling comfortable participating in course discussions, and using virtual conferencing software to meet their learning needs. We also had increased post-satisfaction scores just related to decreased feelings of isolation, feeling a sense of online community, and social interactions. So the takeaway from this really was just, in order to achieve success with online education, educational institutions really need to assist their students with feeling a sense of community. Faculty need to promote communication between the faculty-student and the student-to-student. And now I'm going to pass it on to Dr. Rossiano for the next part of the presentation.
Thank you. So keeping in mind the Course Connect versus COVID now for the spring semester that we faced last semester, as a result of the pandemic in the spring, faculty decided to revisit this concept of Course Connect and decided to integrate Zoom as a platform to enhance communication in student learning. So we studied the use of reflective practice, which were explored during the Zoom sessions. So what we did was students were taught and they followed the Gibbs model of reflective practice in their clinical rotations. And additionally, they were given written reflective practice assignments that included discussion about the course and their clinical rotation for the semester. Zoom was a platform that was provided to the students with a supportive environment to reflect about school assignments and their clinical experiences. So the intention was to use Zoom as a platform for the students to clarify, examine clinical reasoning, critical thinking, and most importantly for students to discover what they may have done differently in their clinical experiences and to discover what they were confused about through the process of using reflective practice. So most importantly, us as faculty, because of the environment that we were surrounded with, we wanted to offer students an open forum to reflect about how their schoolwork and home life was impacted by the pandemic. Next slide. Oh, I have control. Yes. Okay. So how did we do this, connecting with the students? So we decided to ramp up the meetings with the students in order to support them in this environment. So we had 60-minute sessions 2 to 3 times a week. The Zoom was optional, but we did have a high response rate from the students. We provided 2 times, day and evening, 10 a.m. and 8 p.m. Most students who are in the program as registered nurses work 12-hour shifts, so they were able to come and attend either after work at 10 in the morning when they got home, or they can choose to sleep and then come at 8 o'clock at night. And those who were working in the morning, 7 a to 7 p, can attend the 8 p.m. evening sessions. So also, we chose different dates and times for the Zoom meetings in relation to the topics that we were doing, the course outline, assignments and exams that were coming up, in hoping to support them in their stress and anxiety that was evident at this time, to make things facilitate easier and a smoother transition for them when doing their assignments. So how did this affect faculty? Well, we had long hours. We were online most of the day. We had to increase our creativity in order to deal with the pandemic as far as assignments and exams and when we were going to do certain assignments. We had increased collaboration between the full-time faculty. We were basically Zooming all day with each other because now we weren't on campus anymore. We were at home trying to educate and keep connected together, where I just couldn't walk to Justin's office or go to Patty's office. So we were separated. So a lot of phone calls and a lot of Zooms among us. So we rearranged a lot of our schedules and our personal time to meet the needs of our student population. So using reflection with Course Connect. So as we know, reflective studies have found that most learners are uncomfortable about talking and reflecting about their actions. We also know that reflective practice affords analysis of the students' actions to develop sound decision-making. So we really wanted to facilitate and play an active role to create this environment to stimulate students' thinking, feelings, enhance their introspection and self-awareness. So why use reflection? So the students who participated in our study identified, well, this is what our study showed, these were our findings, that reflection improved critical thinking, integrates theory with clinical practice. A repeated use of reflection enabled students to critically analyze their clinical processes and experiences. It cultivated their accountability and professional responsibilities. They were able to identify their self-learning needs. It provided an opportunity to review both positive and negative clinical experiences. And it is apparent that reflective education and preceptor engagement support reflective practice. And NPs agreed that a lack of knowledge about using reflection for both the student and or the preceptor in their clinical environment and or faculty is definitely a barrier for them to evolve in developing their skills in reflective practice. And now I think I'm going to send it over to Justin.
So, and I think that's an understatement of what my two colleagues expressed, is that we were always on Zoom together. And actually, if we went back a few slides before, when you have the guy, Dr. House, who says, this is how I think I teach, and then the guy with all the lines everywhere, this is how I really look like teaching. My colleague, Dr. Moran, when she was doing her postdoctoral study, she would be like, I don't understand. And I would look like a crazy man, right, Patty? Just kind of crossing things around, trying to connect with the students. So we set a date and time as a group, and what we thought was appropriate for the students to get in between 8 a.m. or 10 a.m. versus 8 p.m. And then we decided to use Zoom. The university had Zoom. We decided not to do the Adobe Connect because Zoom does have a lot of features that's nice. So this is what Zoom typically looks like, right? We all know this. We all thought this was going to be great. And in our reality, this is what we always saw. People, they couldn't unmute themselves. They were talking, or I would be talking, and they couldn't find the mute button. They felt that they had to, be sure that they had an appropriate background, be sure that they actually got dressed. We had a couple students initially forget to turn off their cameras, and they'd be lying in bed, after a long shift looking at us. Like, no, you have to be a professional about this. And I don't know about the demographic age, but this is exactly what Zoom reminds me of. The Muppets back in the day. So who attended? A lot of, surprisingly, being that attendance was voluntary, was a volunteer opportunity, a lot of students attended. About 80% of our students attended at least one session a week. Some attended 2 to 3. We had approximately 15 to 20 students per session. And we divided into two aspects. So we always have the faculty facilitated aspect where we looked at the case studies related to classroom topics to reinforce the learnings, clarification of concepts. So if they took a quiz and we noted, well, everyone really did poorly on acute renal failure, let's take a moment to discuss about what that looks like. And that lasted about 20 or 30 minutes. And then we wanted to give the students some time. And that's truly when the reflection practices really came alive. So they were reflection on current practices at the current day, the bedside, what they were experiencing. And then they were saying, well, if this is so difficult for me at the bedside, how am I going to function as an advanced practice provider, as a nurse practitioner? We talked about clinical rotations, and a lot of mentorship that goes into that, to know that I'm seeing COVID patients at the hospital in my full-time job, but then I'm ruling out COVID patients, or we think it's COVID, or we're not really sure what's going on in the clinical arena, and how does that affect them? And how does this whole experience, this experiential learning, shape their future practice as a role? Sometimes it lasted 30 minutes, more often lasted up to an hour to 90 minutes after the fact. So we were on Zoom for about 2 hours. And some examples of the Course Connect sessions, we reviewed recent quizzes that were based on required readings, addressing areas of weaknesses. Again, the case studies discussions of the content that's being taught. So we try to keep it, again, about the curriculum. If they had a concern, if one student had a concern about something that was taught last semester, we may say to them, come talk to us offline. We'll have a Zoom session with you and re-evaluate, re-look at what your learning needs is for that content and reflection of the clinical experience. The students reflect, the student facilitated sessions, it's really the debriefing on the school. We know that work-life balance is a myth, but when you throw school in there, so now we have school versus the employment obligations versus family obligations, it all becomes so much for them. And my colleagues, if you have anything to add, we had students crying. They just wanted to be heard. They felt so stressed. They wanted, we talked about stress reduction techniques and strategies, and all of us just being human beings, not any of us with advanced practice in psychiatry or any kind of mental health.
It was like an emotional release for them to have it. And a lot of students cried because of the experience of the COVID type patients. Most of our students work in critical care areas. So they saw the most intense sick patients. And we also received, I did, many long emails from students just talking about what their work day was like or their work night was like. And you can just hear the stress in their voice, and trying to concentrate on their schoolwork was difficult for them.
And I think they
was an outlet
on Amory to commiserate with, or to talk to their peers that were working and doing the same thing. Because you can come home from those horrible days and your families are not nurses and didn't understand what they were talking about. So they needed that relationship with their peers to discuss what they were going through.
And it wasn't even about nurse to nurse talk. It was, you now have a registered nurse who's now an advanced practice student. And that creates a whole nother environment of stress for them. So we try to give them some tools and some strategies to create a healthier work-life and balance, given the COVID-19 pandemic.
They really needed.
Yeah, no, absolutely. And some themes that they took away from, without going through every student narrative results, they really felt supported. They really felt that they were heard. They really got the opportunity to just they would come to a faculty, as we know as faculty, students come to your office, they're like, I'm under stress, and how do I study in my child? I have childcare, my spouse, and this and that. And this is a whole other level. They appreciated what we provided to them by just giving them an outlet. Not only were we supporting them academically, but we were supporting them as providers, truly frontline providers. Additional narratives: approachable, available, responsiveness has gone beyond my expectations this semester. They just wanted to feel connected. They just wanted, they needed to know that even though I don't work in the acute care setting, and my colleagues may or may not, or my faculty colleagues may work we all work in different environments, that we heard the student, we understand what they're going through and their perceptions, their reality. And we want to support them academically as well as socially. And we know coming out of back-to-back Zoom meetings is the best thing in the world. So, you know, we spent all day kind of planning these Zoom meetings, and then we would have the students, and the students would feel so much better, and then they would get out and they'd be like, we would get out and be like, oh, thank God this is over, just as a release to us. And it was also comforting for us as faculty to know that students have the opportunity to be heard, and they have the opportunity to voice their opinions and their concerns. So at this point, I think my colleagues and I are open up for any questions. It's always a great thing to do a presentation right before lunch because there's usually not a heck of a lot of questions.
I don't see any in the chat. Does anybody have any questions? Feel free to open your mic if you want or put it in the chat. I'll confess that's what I'm doing right now. I'm eating my lunch. So I'm leaving my video up. Any questions?
It's right before lunch.
Yeah, well, look, I mean, I think I'm really impressed with what you did. And one of the things that we've been learning lately with COVID and the pandemic and remote learning environments is that students really crave connection. It sounds like you created a fantastic space for them to connect. Sylvia asks, did you support each other or debrief with each other?
Yes. Well, constantly. And I think we still do.
I mean, this was, as we, you know, if I can go back, this literally was, you know, what I thought I looked like. And my colleagues like, you look like a madman trying to trace these things around. When we try to say, well, we can connect it to this, to this, to this. And Patty would say, it's here, but you need to put it in here, like on paper. You need to spell it out for me, Justin. You know, and I think the three of us, we had such a great relation. We still do to this day, even though I've moved to upstate. We have a great collaborative relationship that we actually understand each other. And we each bring something to the table that supports our students and supports our profession as a whole.
Even though you left us, we still feel like we're working with you because you're always around us and talking to us all the time too.
I'm
So
never gone. I'm always here.
Any other questions? Roberta said, I had the same experience. Students need connections. And as faculty, we need to create connections or make those connections available.
Mm-hmm.
And sometimes it takes a little bending outside your comfort zone. I mean, there's been many times that when the three of us were on these sessions, we were doing it at 8 o'clock at night. We were just as tired as everyone else. It was dark outside. We were sitting, you know, by candlelight. And it was just, it broke the mold of the Monday through Friday, 9 to 5, so to speak.
Yep. But it's like we were also doing our clinical practices. And then I would get home at 7 o'clock, take a shower and go online to be online at 8 o'clock with students. So we just kept going, you know, you just kept going. Nothing else you can do.
That's what we do as faculty, right? We support our students. We really want to support their success.
Yeah.
Any other questions? Well, I don't see any. So I want to thank you all. We'll give everybody a few minutes back for lunch. And thank you all very much for this fantastic session. We will be, I don't know if you provided the materials for us yet, but if you could, we'll make sure to share that with everybody else.
Sure, sure.
All right. Thanks so much. Okay. I'm going to thank you. I did a